How to have a healthy cervix. Method 1. Reducing risk factors. Keeping your cervix healthy is an important component of good reproductive health. Cervical health issues include inflammation, growths, and cancer, but fortunately many of these conditions can be prevented and/or treated. By taking steps to reduce your personal risk factors, and working to maintain a strong immune system, you can keep your cervix healthy. 1. Have regular pap smears. It is always a good idea to visit your gynecologist for a checkup each year. At these visits, you can have your doctor perform a pap smear, a painless procedure that tests for abnormal cells on the cervix. This test is the best way to catch early signs of cervical cancer, allowing you to treat any problems effectively. 1. Women ages 21 to 29 should get a pap test every 3 years. Women ages 30 to 64 should get a pap test, as well as a human papillomavirus, HPV, test every 5 years, or just a pap test every 3 years. Women 65 or older may be able to stop having pap tests. Talk to your doctor to find out. 2. Get tested for STIs. Unless you specifically ask for it to be done, your annual gynecological visit may not include STI testing. If you are sexually active, ask to be tested. If you should test positive for anything, speak to your doctor about treatment options too. Cervical cancer can result from certain strains of HPV, human papillomavirus, which is an incredibly common STI. If you test positive for HPV, don't fret. Most sexually active adults will test positive for HPV at some point. Not all HPV will result in cancer, and most HPV will clear itself up in time. Untreated chlamydia and gonorrhea can also cause inflammation in your cervix. 3. Use condoms. Using condoms during the intercourse is the most effective way to effectively prevent the transmission of STIs. Using condoms is therefore one of the best ways to prevent infection and keep your cervix healthy. 3. Try both female and male condoms to see what you prefer. Sex toys, hands, or anything else that gets inserted in your vagina should be covered by a condom. Limiting your number of sexual partners and making sure partners have been tested also reduces your risk of contracting STIs. 4. Quit smoking. Smoking cigarettes has been definitively linked to cervical cancer. Nicotine and other carcinogens can accumulate in the cervical mucus of women who smoke. If you smoke, consider quitting, especially if you have HPV. It is an important step toward preventing cervical cancer. 5. Consider other possible risk factors. Learning about other potential risk factors can help you, and your doctor, decide if you may be at a higher risk for contracting cervical cancer. Some of these risk factors include being overweight, the long-term use of birth control pills, IUD use, a first pregnancy before the age 17, and a family history of cervical cancer. If one or more of these risk factors apply to you, talk to your doctor about what preventative measures you can take. 6. Get the HPV vaccine. The HPV vaccine has been proven effective at preventing strains of HPV that cause cervical cancer. Although this vaccine is expensive, consider getting it, if you can. Discuss this option with your doctor, and talk to your insurance company about coverage. 6. It is recommended for girls and boys aged 9 to 26 to receive this vaccine. The average cost of each shot ranges from $130 to $150. This adds up to a total of $390 to $450 for the series. 7. Treat cervical health problems as early as possible. Cervical inflammation, growths, and cancer are all treatable conditions, and treatment is the most effective the earlier such conditions are diagnosed. Treatment will depend on the exact nature of the condition, and how far it has advanced. Some common treatment options for cervical health conditions include medication, surgery, radiation therapy, chemotherapy, chemo, targeted therapy.